Here to talk about melanoma. Melanoma is cancer that is increasing in incidence in this country, and so it is certainly a significant public health problem. And when we think about people who are at risk for melanoma, certainly people that are exposed to a lot of sun, getting sunburns, are at increased risk for getting melanoma. There is about 10% of melanoma that could be inherited. Certainly certain genetic conditions can predispose to melanoma also. When we think about things to look for on the skin, there's what's called A, B, C, D, E, which one looks at asymmetry in a mole. So if a mole looks asymmetric, that's one clue that there could be a melanoma, and you might want to have that mole checked. Looking at the borders of the nevi or the mole, looking at the color of the mole. If it starts to change in color, that would be of concern. Looking at the diameter, the size of the mole, and looking at the evolution of the mole. Has it changed over time? And so these would be clues that if you saw a mole changing in this way, that you would want to seek medical attention. A lot of the time we find melanoma at an early stage, and it can be treated successfully with white excision, and people can do very well. When melanoma has advanced to involve the lymph nodes, then surgery has an important role still in removing the initial lesion, as well as removing involved lymph nodes. But we also, in that setting, consider giving additional treatment to try to help reduce the risk of recurrence of melanoma. And this can involve a certain drug called interferon, which has been used to help reduce the risk of melanoma. And now a drug called Ironwood is also being used in the adjuvant setting to try to help reduce the risk of melanoma coming back. When melanoma has spread to a more distant organ, then we do have newer therapies that help to augment the immune system to help fight off the melanoma. And these treatments have been successful recently in being able to treat the melanoma in better ways than we've been able to do previously. Now, Christine is under treatment for melanoma, and she's been under treatment for the disease for many years and has undergone many of these therapies, and she's here to discuss her experience.
Yeah, originally it started in 1985 at a young age. I was about 22, but I laid in the sun and I laid in tanning beds, and that's when I noticed the mole starting to change. So that's when I had it removed, and it was stage 3-4. And at that time in 1985, I had the surgery and the margins were clear, so that was it. Fast forward 21 years later to 2006, it metastasized in my neck, and as Dr. Kellogg pointed out, I did the interferon, and I did speak to some melanoma specialists down at the University of Arizona. He had mentioned that there was, at that time, not a lot of therapies, and so It was hard because after interferon, it didn't seem like there was a whole lot of therapies out there. And like Dr. Kellogg said, in the last 10 years, they just kind of exponentially have come up, and I have been on most of them in Yervoy, and currently on Keytruda. I've had several surgeries, several bouts of radiation. So the last 10 years have been grueling, but doable, and I credit Ironwood Cancer Research, the doctors, of course my doctor, Dr. Kellogg, and his assistant, and everyone that works here, to keep up with the therapies that are going on, because I seem to just keep going, and I've had good news. I'm on a therapy called Keytruda right now, and it appears that the tumors are shrinking. So yeah, melanoma has come, therapies have come a long way, but we do need them because so many people are laying in tanning beds and not getting their moles checked. They think it's just skin cancer, and they don't realize that they can get further into your skin and into your lymph nodes and really cause a lot of problems. So we do need melanoma May to be, get out there more and let people know that they shouldn't be laying in the sun or use sunscreen.